Hello and welcome. I'm Bridget Burke, President of HIMSS Northern California. We are excited that you could join us today and meet our Innovation Award winner and runners-up. It is my pleasure to introduce you to this group of talented individuals and their companies that are shaping the present and building the future of healthcare. Each of them will have 4 minutes to give you an introduction to their company and or innovation. I'm going to paste the order into our chat now so that you all can see who's going to be presenting. And I'm also going to put in links to their website so that you can look at more information about them as we go through this session. While we don't have time for QA in this session, it is quite short. You can speak with each of them directly in our Innovation Awards Expo booth. Right after this session ends, the Expo show floor is open for another half an hour, I think. So please, after this presentation, do go to the Expo show floor and meet with all these wonderful Innovation Award winners and runners-up. So with that, let's go ahead and get started so we can maximize the time for each of our presenters. The first one up today is going to be our winner, which is Noor from Telemedix. Welcome, Noor. Please share your screen and begin your presentation.
Hello, everyone. Do you see my screen?
Yes.
Okay. Look closer at this screen. Look good. Let me zoom in so you see what I'm trying to show you. See this guy here? This is John flying. He's paragliding. John is my friend. We both had similar flying accidents, but we had different access to care. I'm fully recovered, flying and running and happy again. He's handicapped today because of access to care difference. This is why I started Telemedix. End of 2020, I incorporated Telemedix in Hawaii with the mission to provide faster access to care, to enable providers provide new ways for their patients to get faster access to care. We built this platform, which has these 4 components. Async consort, that's a new innovation. That's a micro consort. We built the referral components, which if the micro consort is not sufficient, it converts to a smart automated referral, much faster than the use of fax, regular phone calls, which makes access to care much faster. Embedded in this platform, scheduling, automated appointment reminders, and telemedicine, as everybody knows, telemedicine and scheduling. Currently, we have a pending contract with the state of Hawaii Department of Health and few contracts here in Hawaii. So please, guys, make a pre-orders today for this platform that got us this award and got us connected with the right people that will get us a milestone closer to our dream of being able to help providers worldwide provide innovative, faster access to care, especially in Hawaii. Hawaii has many islands. So traveling between the islands is almost not an option, especially if you want access to care, fast access to care. This platform makes access to care much faster for rural areas. We're starting here in Hawaii. The platform is digital, so we're also looking for customers outside of Hawaii. Please come see us at booth number 1 to make your pre-orders. And we have 2 possible ways for partnering with us. We're raising a seed round, $1 million for 10% ownership of the company. And you can be a partner with us piloting our async consult. It's a unique way to provide fast access to care, while it's also embedded in it auto reimbursement, because async consult is with the platform, it makes it possible to get reimbursed for your practice or your health facility for care coordination time that you spent with other doctors. It makes it more possible to get the reimbursement. And we have one more thing. Today, literally, during when I was in the expo, we got the confirmation that we got the contract that we were waiting for over 6 months. So as a celebration, come see us at booth number 1, make your pre-order and get 50% discount. We really want, with our innovation, to have as many providers able to provide faster access to care. Thank you. We're booth number 1. We're the winner and the champions, and aloha. Thank you guys. Booth number 1.
Thank you so much, Noor. That was quite the presentation and sales pitch. Next, we have our first runner-up, Anupam from SageSurfer.
Yeah, hi, hope everybody can see my screen.
Yes.
So great to be here in front of you and telling you about SageSurfer. I'm Anupam Khandelwal, co-founder and CEO of SageSurfer. We are a behavioral healthcare SaaS startup. Since we launched, we have demonstrated 78% reduction in rehospitalization, 54% reduction in program dropout rate, and provided 12 to 15x ROI for our customers. Received support from National Science Foundation, recently received Platinum Award from Mars Challenge as part of the Austin cohort. This is just the tip of an iceberg. Let me tell you about the problem we are solving. We are currently dealing with mental health epidemic in this country. Healthcare systems don't know how to solve it. 70% of the patients/members engaged in the healthcare program focused on behavioral health end up dropping out, leading to 47,000 suicides per year that could have been prevented. The core problem here is providers simply don't stay in touch with members, or they lack visibility how patients is doing between the clinical visit, or don't have the right tools to deliver proactive intervention. I have personally experienced the same issue. My cousin was one of those 70% that dropped out of those programs. And fortunately, due to lack of proactive intervention, he ended up taking his life. The death of my cousin impacted me so greatly that I started SageSurfer. At SageSurfer, we have built a HIPAA-compliant, comprehensive platform to coordinate and facilitate behavioral health care for complex patients. We do this through an innovative platform that allows for seamless engagement between the patients and the entire care team. On the professional side, physicians, the nurses, the case managers, social service providers, and others. And then on the personal support side, including family members, friends, and peer specialists. Let me show you a quick demo of our HIPAA-compliant mobile and web platform. customers in community mental health centers, treatment centers, county system, education institutions, and finalizing pilots with health system. We are B2B subscription service. I've assembled a well-rounded team to solve this problem. In addition, we have got exemplary advisory team to help us in this mission. We are building this to help people like my cousin, where existing infrastructure have failed us. If you want to do well while doing good and make an impact on mental health care and help us save life every single day, partner with us to take mental health care to the next level. Thank you. To learn more, please visit the booth number 2. Thanks a lot.
Thank you, Anupam. Next, we're going to go to MedReportGuard. And Adrian, if you could please bring your presentation up.
Since 2013, MedReportGuard has been developing pioneering solutions in the interpersonal violence space, beginning with our work on domestic violence, our subsequent work on sexual assault across the state of California, and now our expanded capabilities covering all of the different types of interpersonal violence. Our approach is evidence-based and motivated by the need for more trauma-informed care, improved understanding of these complex patient conditions and social determinants of health, and the very real financial, legal, administrative, and ethical impacts of these patients. What's important to think about here is really the scale of the impact as well. It's not just isolated patients coming to the emergency department. This affects every single level of our healthcare system. And the cumulative financial impact is currently estimated as in excess of $90 billion a year, which is an impact that is larger than cancer. To address some of these challenges, we've spent the last 10 years working side by side with healthcare providers, trying to develop a system that would help improve the efficiency and the efficacy of kind of this more coordinated response to victimization. So the first area that we've worked on is mandatory reporting. So in all the states across the United States, you are required by law to report certain cases, which include suspicious injury, suspected child abuse, or suspected dependent and elder abuse. And what we can do is generate these cases. So it will open up a new case file. You can complete all the documentation required, and this gets automatically shipped off to the agencies that should receive it. The second area that we work on is forensic medical examinations. So these are cases where you may need to collect evidence that's going to be used in court. So this includes physical evidence such as DNA, includes information about the type of case, as well as any associated images. These are also able to be documented electronically and submitted to all the different agencies that need to receive it. And lastly, we can build in additional screening tools such as the Jackie Campbell Danger Assessment, which is a wonderful tool for screening domestic violence patients and understanding risk, as well as doing warm handoffs to local advocacy services, both community-based as well as systems-based advocacy services local to where that patient may live. One of the key ways that we've significantly improved the collection of forensic medical evidence is through the development of interfaces such as this one. And this is a body mapping tool. As you can see, you can document types of injuries associated with, in this case, a case of child abuse. And this becomes an incredibly powerful resource for investigative agencies such as law enforcement or child protective services that may be looking into a case. But this also goes a lot further when using this for potentially something like prosecution. Historically, this is all done on paper. We see healthcare providers, with scribbles, indistinguishable marks, and so it becomes a little bit cluttered and very difficult to convince someone like a jury of what the injuries are and really documenting the extent of those injuries. And finally, we have the Analyze module, which has a great set of dashboarding and data visualization tools that are incredibly useful for population health management or any sort of administrative reporting that you might do at your hospital or your private clinic. We also have Advanced Search, which is great for any sort of quality or process improvement initiatives, research, or a deeper analysis of trends, such as the impact of maybe gun violence or the prevalence of certain types of injuries that you may want to train your staff around. We are immensely proud of the technology and the positive impact that we've been able to have to date. So if you are interested in learning more, please visit us at MedReportGuard.com or do reach out to myself at infosec@MedReportGuard.com.
Thank you so much, Adrian. That was to the point and fast and very informative. Next, we have NurseBrain and Samu. Samu, please go ahead and start your presentation and your video.
Thank you so much. I'll begin with the video.
NurseBrain is a collaboration platform that improves patient outcomes and reduces hospital expenditures by optimizing nursing communication and workflows. Our cross-platform software enables healthcare organizations to autonomously create and manage custom processes that build cohesion and engage stakeholders. Despite advances in technology, many nurses continue to rely on paper-based methods to organize their nursing duties and relay patient information. While some EHR vendors provide digital alternatives for nurses, they are often fragmented, difficult to use, and limited in functionality. Not only do unintuitive digital systems contribute to nursing burnout, they indirectly contribute to increases in incidental overtime and communication-based medical errors. NurseBrain solves this problem by helping nurses spend less time synthesizing scattered information and instead focus on providing high-quality patient care that is both timely and personalized. Our nurse-focused platform is flexible and portable, works on Android, iOS, and desktop devices, and can be customized for multiple nursing specialties and healthcare modalities. For example, a nurse floating from the intensive care unit to the medical surgical unit can access the medical surgical NurseBrain and quickly know what routine tasks are expected during their shift and what information is required to be communicated during the patient handoff. Furthermore, when integrated with a hospital's EHR system, NurseBrain ensures that the nurse has up-to-date patient data on the go and instantly alerts nurses of critical test results directly on their mobile devices. Still within a year of its launch, our platform has gained over 7,000 nurses and a combined satisfaction score of 4.8 on the Apple and Google App Stores. We are now seeking a hospital to successfully pilot NurseBrain and further demonstrate the value we have to offer. Please visit our booth after this presentation to get started.
Thank you so much. I will go ahead and play my slideshow. Hello, thank you for watching the video. My name is Samu. I'm an RN, and I am the founder and the developer of NurseBrain. So essentially what we're doing with NurseBrain is we're optimizing nursing collaboration. Approximately 80% of errors in healthcare are credited to miscommunications that occur during the transfer of care. In addition, despite the promise EMRs hold to improve efficiency and performance, they often fail to meet user expectations and are seen as a major contributor to clinician burnout. So what we do at NurseBrain, we improve communication. NurseBrain allows nurses to gather and share pertinent patient information quickly and efficiently, while making it easy for nurse leaders to standardize and customize the process. Also, we have a nurse-friendly design designed by a registered nurse. NurseBrain, it empowers the nurse to organize their workflow and to tell the story of the patient in the nurse's own words. Nurse leaders, likewise, can customize and standardize the department-specific workflows as needed. We estimate, based on our research, that the average 500-bed hospital would save about $5 million. This is due to the fewer communication-based medical errors, the reduced nursing burnout, the less incidental overtime, also the increased patient satisfaction. Let's connect. We are ready to pilot our app in a hospital setting. We've already demonstrated that nurses love our app. We have very high user reviews. So please, let's connect. I'm in booth 3. We have our website, nursebrain.com. Also, you can send me an email, samu@nursebrain.in. Also, please take a moment to scan the QR code as well. That's how you can get a hold of me. Thank you so much, and I look forward to working with you soon.
Thank you, Samu. That was very interesting and very concise. Let's go ahead to our next presenter. We have Penny from StressPal. Penny, if you want to go ahead and share your screen and turn your video on.
Okay, hello. Hello, everyone. Thank you so much. I am Penny Sempel with StressPal, and we are here to help tackle system drivers of burnout. And we do not need to go into detail on what those are. You are all well aware, those of you in the health profession. And in this process, we are seeking to protect the resilience and well-being of your teams. It's not progressing here. Let me see. Okay, that worked. Okay, so we have fortunately the Joint Commission, the AMA, the quadruple aim, who have all shown a bright light on the importance of helping all of you in the healthcare workforce, and really the entire healthcare workforce. Clinicians, care teams, support staff, administrators are experiencing extraordinary overwhelm, frustration, and many issues that are impacting patient care, as well as the feeling of fulfillment, impacting performance, retention, and a whole host of legal issues that compromise care. We know that your time is extraordinarily used up, as are your resources, and it's no easy task to say, well, okay, so we agree, we do need to have more resilience here and create these cultures of well-being, but how do we do that? In fact, this is quite a complex process. It's got to be easy, it's got to be ready to use, and I'm going to show you just a quick overview of how we've done this to create a virtualized, a ready-to-use, customized virtual home with ACCME accredited content that's a brain-based, comprehensive training program in the best practices intervention strategies to build a more resilient brain and to protect this super power that you have, resilience, but it can be worn down, as you all know, with these persistent stressors. We've created this home with dedicated communities for your team as an easy turnkey platform with just a unique URL. There's no back-end build that has to happen. You customize it, for your own teams, your own leaders, mentors, coaches. We love partnering with coaches and with your teams to bring this to scale for your entire workforce. And it is anonymous and secure. So we've built in this important element that your learners' participation in this program is not shared with the organization. Reports are all anonymized and aggregated. It is strictly grounded in the evidence-based research on psychological flexibility and resilience, which is a complex phenomenon in the brain and well worth protecting. So I'm going to see if I can start a little short demo here.
There's a firestorm in healthcare. You didn't cause it, but you can do something to change it. Our brains have the remarkable capacity to generate distressing thoughts, uncomfortable physical responses, and ineffective self-defeating behaviors. It's a vicious cycle of stressors and stress-triggered responses that get in the way of effective collaboration. Tackling system drivers of burnout and living the life you value. Break the vicious cycle with StressPal Frontline. Get robust tools for resilience under fire. Arm yourself and your teams with best practice interventions to maintain and build psychological flexibility and resilience, the brain's antidote to the stress response. In this self-paced program, learn practical strategies to immediately apply in the heat of the moment, to more effectively problem solve and collaborate, defuse your stress response, and choose strategies aligned with what you value. The secure, web-based platform is customized exclusively for your community. Peer interaction reinforces engagement. Wellness leaders send messages in real time and centralize well-being initiatives in one place, accessible on any device. Learners get ongoing support and stress relief exercises used in clinical practice for 12 months. Earn valuable credits while acquiring new self-care and interprofessional skills in bite-sized modules over 4 weeks. Organizations are implementing StressPal Frontline across the workforce to foster emotional well-being, communication, and morale. With StressPal Frontline, mobilize effective programs to strengthen individual and organizational resilience, tackle system drivers of burnout, and deliver quality care.
Thank you. Well, we have pulled together a fabulous team. We have been 5-6 years in research and development. This tool we are launched this last year, and happy to say we are receiving outstanding reviews. Our team are from fields of psychology, medicine, nursing, health IT, and of course the creative talent that developed this fabulous video-rich program. No less than the AMA has demonstrated that burnout interventions generate a solid return on investment. That's what's hidden under there just in looking at the recruitment costs alone, much less the enormous costs related to risk mitigation and issues around patient care. So we would love to have you come by. I'm in booth 3. We would love to talk with you about how we might be able to help you proactively accelerate your resilience center of resilience at a low cost and to scale for your entire team. So thank you so much.
Thank you, Penny. Great presentation. Next, I'd like to bring up, last but certainly not least, Rusika and Mamsen Health, who literally went from concept to website within just the past few weeks. I'm really amazed at their development. So please go ahead and share your screen.
Well, thank you so much for the introduction. We are so excited and honored to be here. My name is Rusika, and I'm the co-founder of Mamsen Health. We provide digital health solutions, paving the way to the future of women's health. We are a team of compassionate and ambitious women from diverse backgrounds, all sharing the common vision of improving women's health. Like Bridget explained, we are a group of graduate students at Stanford University, and this is a very early stage innovation that started out as a group project in our biodesign class. Opioids are widely prescribed as pain relievers in the US and are generally safe when taken for a short duration as prescribed by the doctor, but can quickly lead to dependence, and when misused can lead to addiction, overdose incidents, and deaths. Studies have shown that 1 out of every 2 patients who undergo surgery are discharged with an opioid prescription. One of Mamsen Health's first projects aimed to tackle the opioid epidemic in women post C-section surgery. We provide a way to educate discharged opioid naive post C-section patients about the risk of addiction and thus help them avoid becoming addicted to opioids. We would love to keep this conversation going, and we are also looking for seed funding. To learn more, come see us at booth 2. Thank you.
Thank you so much. Love to see you going straight from grad school into young entrepreneur. Really wonderful. Let's go ahead and we're going to close the session. So on behalf of HIMSS Northern California Innovation Awards team, we thank you all for attending and meeting our amazing award recipients. To learn more about them, please do go to our virtual expo and visit them in the Innovation Showcase Expo booth for a live demo right now. The expo floor is open till 5 o'clock. They're all hoping to see you there. So thank you all again and hope to see you in the expo in a few minutes.